Well, hello, hi. I'm Dr. John McAllister, and I'm a dentist in Downey, California. We're about 15 miles southeast of Los Angeles, about 10 miles south of Pasadena, and about 10 miles north of Long Beach. And today's presentation is going to be on laser ANAP, laser assisted new attachment procedure. Now, the new is not so new. It's been in the literature over 20 years. What that references is the literature that we have if you look up here, the FDA clearance to say that we could reverse gum disease being the #1 cause of tooth loss. So today's presentation is going to go over that. What we're going to talk about today is the scientific evidence. So yes, there is scientific evidence. We can prove it. We'll start with just last month's papers published in the peer-reviewed literature. We have the McCauley-Rams paper that talks about the bacterial change after using the laser in the gum pocket. The next one is the AAP systematic review of the regeneration workshop that was published in the Journal of Periodontology. Then you have the Aoki paper, and that was published in Perio 2000, and that was also a systematic review, and both those systematic reviews were favorable to the LANAP, and I'll be going over that in just a second. So we'll talk about the first paper, that is the McCauley paper, and the McCauley paper, you could look it up online. And what it did was they took bacterial cultures pre-LANAP and then post-LANAP, and they found that they had quite a bit of bug kill. But in summary, there are over 375 patients published over 16 years. That's updated to 2014. So 341 patients in 8 peer-reviewed journals and 2 peer-reviewed AADR abstracts, 2 RCT, 1 human histology, 2 prospective case studies, 2nd human histology, 5 retrospective case studies, 34 patient case studies, and 7 non-peer-reviewed periodicals. To say that there's not enough literature to support LANAP, well, I'm going to turn it on those people who say that. Well, LANAP's been in the literature almost 20 years. And whose profession is this? Is it whose profession is this? Why hasn't anybody, if there is the lacking of studies, then who's not putting it forward? Where is the leadership behind showing that this works or doesn't work? So let's look at the 2 human histology studies. Both of them were published in the IJPRD, some call it the picture book. And there's the Ray Yuckna paper, Histologic Evaluation of the Nd:YAG Laser Assisted New Attachment Procedure. This has been out since 2007. 6 patients, 6 SRP on the control, and 6 LANAP teeth on the LANAP side. The interesting thing about something like this, these people donated their teeth to science so that we could see what actually happens at a cellular level. The histologist was blinded. The clinician was not. No mention in the paper who was calibrated. It's a proof of principle study, because I've been showing x-rays and periodontal chartings, and I have lots of those, and we'll go over those in time. This is now at a cellular level, showing what we can accomplish. Human histology. These are not dogs. These are people who donated their teeth so that we can know as scientists what actually happened. And if you look at what's going on, that the N represents the notch placed in down into the pocket in calculus, and that represents the point at which the disease process is at. And then and I've spoken to Ray, and he tells me that what he did here, intentionally, if anything, he was going to err on the side of above the calculus. So again, he tells that this is the most difficult part of the whole study, is putting a notch down in the calculus without reflecting a flap. But what are we seeing? We're seeing new cementum. That's where the new comes from. At a cellular level, we're getting new cementum. We're getting new bone, new connective tissue attachment Here's the junctional epithelium way up high. And so those who say that it doesn't work, well, maybe you like junctional epithelium. It's not a bad result, but hey, I'll take regeneration any day. Okay, so if the Ray paper wasn't enough, then Mark Nevins comes in and he shows his work, also published in the International Journal of Restorative Dentistry. An amazing stuff. Look at the cellular. This was histopathologist was Schulpak, and he presented over at the Millennium Study Club the day before the AAP meeting, and Marcelo Camello, he's a periodontist down in Brazil. The moment he saw these slides, he was in the next class up in Los Angeles. So he flew in from Brazil to learn how to do this LANAP. Why? Well, it's right there, right in front of you. That's why. You're getting regeneration. At least in my mouth, that's what I want my periodontist or dentist to do. I want them to give me the best possible outcome. And that's what LANAP is able to do. Again, at a cellular level. These are the Sharpies fibers, new cementum. Look at these cementoblasts. Look at how nicely laid down these are. When Peter Schulpak presented this, he was impressed. And this is a guy who does human histology on a daily basis. That's what he's involved with. All day, every day, that's what Peter does. He's out of, I believe it's Switzerland or Sweden, one of those over there. But again, amazing results. Human histology. Look at the fibers into the new cementum. Look at the fibers laying down perpendicular to the root surface. That's what I want. If you have gum disease, what do you want? Do you want just long junctional epithelium, or you want this regeneration? Here's another slide from that work. Again, we have new cementum up the root surface. We have the PDL circumferential ligaments attaching to the tooth here, the junctional epithelium down here, and new bone. There it is. It's full regeneration in human. Again, those who say there's not enough evidence, you got my evidence, and I'm gonna talk to the periodontist here. Every periodontist has a 6-month money-back guarantee. 30% of the American Academy of Periodontology do this LANAP, and they still fight us on it, and all of them had a 6-month money-back guarantee. Do you know that no periodontist has ever returned a Periolase? Why would they not return it? It's either one of two things. One of two things. They're either stupid or it actually worked. Take your pick. It can only be those two. So let's also look at the clinical studies. There's 2 clinical studies. Here's the first one. The University of Colorado at Denver was the main site, but there was also 2 other universities, Louisville and Maryland, and 2 private practices. It was 5-site multi-centered, university-based, randomized, prospective, blinded, longitudinal, calibrated clinical trial. Split mouth, 4-quadrant design, LANAP, scaling root planing, modified Windward flap. And our results. Okay, so here's the results, the change in probe depth. You have just polishing their teeth and going over home care. They didn't do so bad. Scale and root planing, they did all right. And here you see LANAP and modified Windward flap running in at about the same numbers. especially at these bigger numbers. These bigger numbers, you're going to get a nice result post-op. Okay, so here's the gain and attachment level. There's LANAP, there's modified Whitman, and there's scaling and root planing. LANAP comes up on top. There's the article. Okay, so that's the Nevins presentation, and that was these teeth were cut out at 9 months. Again, human histology. How could you deny human histology? I mean, it's at a cellular level of what is happening. So some of you ask, how does it work? Well, it's an Nd:YAG laser, and it goes into the pocket, and these little black things represent the bugs that are down there. And it goes to depth. It goes beyond where the tip is. We don't have to touch the tissue. We can go on 4 or 5 millimeters beyond into the bone, into the epithelium. Look at the literature. P. gingivalis lives inside the epithelial cells. If P. gingivalis lives inside the epithelial cells, it moves into the epithelial cells and it reproduces without going into the interstitial tissues. It invaginates into the next epithelial cell and it moves on. So if the laser could come in and kill these P. gingivalis at depth into tissues where it's not even touching, into the cementum, into the calculus, into the bone, into the epithelium, into the connective tissue, that's where we're getting the bug kill. And you could look up the Macaulay paper that shows the difference between using a laser and the Nd:YAG specifically and using just ultrasonics. So we all want to be scientists and we all want the best evidence available. And if we look at the evidence-based pyramid, our in vitro test tube research, that would be like the Harris paper that showed that the Nd:YAG is very good at killing P. gingivalis and blood agar without affecting the blood agar. Then ideas, editorials, and opinions. My opinion is this works amazingly well because I have cases, and I have personally published case reports and case series. You can look me up on Compendium. Again, this is a lower form of evidence than case control studies or cohort. Now let's look at the highest form of evidence. Let's look at the systematic reviews or meta-analysis. Well, here it is. This was published in the Journal of Periodontology. This was funded by the American Academy of Periodontology. This is now a systemic review. Remember, we talked about the highest form of evidence. This is it. This is periodontal regeneration, intrabony defects, a systematic review from the AP Regeneration Workshop. And what do they have to say about LANAP? Well, here it is. Let's take a look. LANAP. This technique is intriguing in that it is another approach to minimally invasive surgical therapies as reviewed by Cortellini. A minimally invasive surgical approach may offer advantages in regeneration of defects in the aesthetic zone, in which minimal soft tissue change is required. Additionally, because of the minimally invasive nature and expendable surgical materials required, this approach may be appropriate for multiple defects as a first line of management. What they're saying is you don't have to use biologics with LANAP, and the costs of these biologics do add up. There are some risks when you add these products. So yes, LANAP is on the map. You could look on YouTube. I have quite a few videos on this very subject. Again, an interesting statistic is that 1 out of every 4 active AAP members are doing LANAP. Again, the interesting statistic about that is that all of them have had a 6-month money-back guarantee. None of them have chosen to exercise their right of return. And CRA, the Gordon Christensen publication, did show that they sent out evaluations to the clinicians who had been doing LANAP, and they asked them, what do you think? And it got a 9.7 out of 10. No other product before or since has ever gotten that high a review. The ethics of the company, 100% of them said it was spot on. Some really interesting statistics on that. Go ahead and take a look at that. If you want a copy, I'll get it to you. Just send me an email, john@johndds.com. Interesting stuff there. Here again, Millennium will give you a Periolase periodontal package, and they'll give you a clinical guarantee. If Millennium does not show you that you can get reverse gum disease, and they'll quote the Harris paper with the McCarthy, Gregg, Tilt paper, and the results that they got on that, that's what they'll back you up on. If you can't get what they got on the Tilt, Harris, McCarthy, and Gregg paper, which is 90% of the time you'll get 50% reduction in pocket depth. If you can't clinically get that, then you get your money back. So everybody who's ever purchased, nobody has ever returned it for the clinical guarantee. You got to ask yourself, are they stupid or did it work? I'll let you make that decision. And if you want more information, you can contact Millennium Dental. This is their phone number, 1-888-49-LASER. Look them up online, lanap.com. You can look me online, lasergumdentist.com. My opinion, though, is that you should just do it. If you have patients who have gum disease, just do it. Do it for them. Do it for them. Look me up online, lasergumdentist.com. I look forward to seeing you. If you have any questions, go to my YouTube page, and underneath there, just fire off a question. I'll get back to you right away. Look forward to seeing you online. Look forward to you helping your patients keep their teeth, which is what we should all be doing. Lasergumdentist.com. See you soon.